If you're a young athlete or no one, you are probably all too familiar with the frustration of being sidelined. Today, we're digging into a common culprit behind that deep, nagging hip pain, the kind that just won't go away.
Right? It's a huge question for athletes, parents, and coaches. You're at the top of your game, feeling great, but then this ache deep in your groin starts showing up. Every cut, every pivot, maybe even just sitting for a while. So what is actually going on inside that hip joint?
Well, the culprit often has a pretty complicated name, femoroacetabular impingement, or just FAI. It sounds like a mouthful, but the idea behind it is actually pretty simple. Your hip is a ball and socket joint. With FAI, there's a basic shape mismatch between that ball and socket, which causes them to jam or bump into each other when you move. And that jamming leads to a very specific kind of pain. It's so classic that when you ask someone with FAI where it hurts, they'll almost always make the C sign, cupping their hand right around the front and side of their hip. It's one of the very first clues doctors look for. Okay, so to really get what's happening, we need to look closer at that shape mismatch. Let's really dig into the anatomy and see exactly why these hips are jamming up. These x-rays here tell the whole story. On the far left, you've got a normal hip. See how the ball is perfectly round and fits great in the socket? But now look at the others. The cam deformity has extra bone on the ball, making it kind of egg-shaped. The pincer deformity is when the socket covers too much of the ball. And mixed, well, that's just a combo of both. Let's break those down. Think of a cam deformity like a ball that isn't perfectly round. As it tries to rotate in the socket, that bony bump just jams into the rim. A pincer deformity is the opposite issue. The socket itself is too deep, so it pinches the neck of the femur during normal motion. So, where do these shapes even come from? Well, there's a really strong link to high-impact sports that we play during our teenage years. You know, when our skeletons are still growing. All that repetitive bending and twisting in sports like soccer and hockey can actually shape how the bone grows, sometimes leading to these FAI shapes. And this brings us to a super important point. How do doctors figure out if you actually have FAI? Because it's not as simple as just glancing at an x-ray. It's more like detective work, and it requires a very specific set of clues. And the golden rule for making that diagnosis comes straight from the research. You have to have a triad. That means symptoms, signs, and imaging findings. Just one or two of these is not enough to call it FAI. So let's look at that triad. First, you need the symptoms. That's the patient's story, the C sign, the pain. Second, you need the signs. That's what a doctor finds in a physical exam, when they can move your leg in a certain way and reproduce that pain. And third, you need the imaging that actually shows the cam or pincer shape on an x-ray. You need all three. And this right here is where things get really interesting. Just because your x-ray shows one of these shapes, that absolutely does not mean you have FAI. The shape itself is only 1/3 of the story. Get this, a study looked at NFL prospects and found something wild. A whopping 90% of them had the bone shape for FAI on their x-rays. 90%. But guess how many of them actually had any pain? Only 31%. That means tons of elite athletes are out there competing with these abnormal hip shapes and feeling perfectly fine. And it's not just pro athletes. Looking at over 2,000 adults with no hip pain, researchers found that over a third had a cam shape and 2/3 had a pincer shape. So why does this matter so much? It means these shapes are incredibly common, and they only become a problem. They only become FAI when they actually start causing pain. So for the athletes who do have that full triad, the symptoms, the signs, and the imaging, what's the game plan? What does that road to recovery look like? Let's get into the treatment options. You've basically got two main paths. The first is non-operative, and this is almost always where you start. It's all about physical therapy, strengthening the core and hip muscles, and maybe changing up your activities a bit to avoid what hurts. The surgical path is really for when the pain just doesn't go away, and the goal there is to fix the structural problem itself. When surgery is the answer, it's usually done arthroscopically. That means with a tiny camera and small tools. For a cam deformity, they do something called a femoroplasty. You can literally see it here. The surgeon is using a tiny burr to re-sculpt the ball of the hip joint, shaving it down to make it perfectly round again so it can move without jamming. And if it's a pincer problem, well, that's called an acetabulobolasty. It's the same idea, but here the surgeon is trimming the rim of the socket. They're removing that extra bone that's over-covering the ball, giving the hip more room to move freely without getting pinched. Reshaping the bone makes a lot of sense, but what about the results? What can athletes really expect after they go through treatment? And what does this all mean for the future of their hip? The outcomes are actually really good, especially for young athletes. One study showed an 84% return to sport rate after surgery. And the best part? Most of them got back to playing at the same level, or in some cases, an even higher level than before. And this is so important to hear. For anyone worried about wasting time with physical therapy, the research is clear. Trying a solid PT program first does not hurt your chances of having a great outcome if you do eventually need surgery. It is a safe, smart first step. Now, this brings us to the big, long-term question that has always surrounded FAI. The original theory was that this constant jamming and rubbing from the bone mismatch would wear down the cartilage and lead to early hip arthritis down the road. And that leads us to the million-dollar question, the one we still don't have a final answer for. We know surgery is fantastic for getting athletes out of pain and back on the field, but the biggest hope, that by fixing the shape we can prevent arthritis 10, 20 years from now, that's the piece of the puzzle researchers are still working hard to solve.